Welcome everyone. Here we are at the Global Empowerment Summit, and I'm here with Viktor, and he is someone who is very, very well informed in the mental health status and the mental health arena. And I would love to introduce him a little bit better. So we will go on, and he will give us a little bit of update about the mental health research and how does it work and what is it about. And I'm really, really looking forward to our collaboration, because on the 21st of October, we will also stream and you can access the 5th International Mental Health Conference that he's organizing, and we will have amazing speakers there. So Viktor, just to start, let me know how was your day. You know, we always start with this question to be be careful about your mental health. So how are you today?
Okay, yeah, kindly thanks for invitation. In my country now it's morning, so only is starting, and I hope the start is very well. Okay, I like this famous British phrase, not too bad, but in the autumn, I hope that sunny day is very best. It's the best start of the day. And now we again have some sunny days. It's
so
great.
The listeners are already tuning in. Some of them are from India, and Ria is from Tunisia. So I'm really, really happy to have you here, guys. Viktor will go on with his presentation, and he will bring up some latest research results. So I'm really, really happy to share this with you. And Viktor, if you are ready, then we can go on with your presentation. Just let me know when you are ready, and you can share the screen. And for Riai and Sharm, if you have questions, please make sure that you are putting in all the comments and all the questions into the comments, so that Viktor can answer. It's rainy. In India, it's rainy now. That's what she's saying. So Viktor, the stage is yours.
Yes, thank you. Do you see my screen? Do you see my screen right now?
We can. Yes. All good.
Yeah, okay. Yeah, perfect. So, regarding comments and questions, feel free. Don't be shy. You should to introduce your opinion. Don't cover. Don't hit your opinion. Please share it with me, and it will be my pleasure to respond for your questions. Okay. My presentation is titled New Tendencies and Trends in Mental Health Research, Post-Pandemic Context. I would like to introduce myself firstly, in order to ensure you in quality of this my presentation. I am PhD. I am associate professor. At the same time, I was elected as director at large for years 2021-2023 for World Federation for Mental Health. At the same time, I am editor-in-chief of the journal Mental Health Global Challenges, Italian scientific journal, and also I am in editorial board of several other journals, and we have some comments from Tunisia, and but I also associate editor in Algerian scientific journals platform, so it's not far from Tunisia. Yeah, and at the same time I am coordinator of international platform on mental health, and I was national expert at Horizon 2020 from Ukraine. So let's start my presentation. The main relevant questions for this my presentation are: how long will the pandemic last and the restrictions imposed? What will be the world, especially scientific research world, be like after the pandemic? What's the main impact of pandemic on our life, and how we will live, how we will deal with mental health of populations and individual in this pandemic and or post-pandemic epoch. The answers to these questions are crucial to forecasting and developing strategies for the future development of global society, large national society, and of course individual communities as well. I have divided my presentation into traditional parts. I mean traditional research parts for traditional academic research on mental health. So first part, it is introduction. Yeah, the COVID-19 pandemic affected not only the physical health of the population, individual. Significant changes have occurred in intergroup relations, social and political life. I mean changes in traditional interpersonal, social, political construction of interaction. The mental health of the population individual is traditionally seen as an integrated indicator of the population individual's experience of physical and emotional well-being. And of course, it is a perception, reflection of various aspects of social life. Analysis of current research on the impact of the COVID-19 pandemic on the mental health of individual populations is essential information for policy making in the field of mental health. After all, the results of this scientific research are quickly integrated into the qualitative basis for the development of practical recommendations in various areas of society. The aim. Each research should have aim. It's necessary for any activities, of course, and for research activities. The purpose and objective of the study are to clarify the specifics of reflection by modern scholars on mental health issues. It was conducted by analyzing current research in the field of mental health of different populations and highlighting the main directions, trends, key research concepts after the COVID-19 pandemic. Next part of any traditional research is design, methodology, approach. So first part, study selection, how we select, how we administrate in this study. Research papers were found by citing the PubMed database. Why? Because PubMed is a traditional, reputed scientific database. So if we read something in database, we can be sure that it is approved, verified with scientific review. So it's very verified information. For this sitting, we using the keywords mental health. In addition, we used related COVID-19 mental health, impact of COVID-19 on mental health, and COVID-19 mental health impact keywords to ensure the inclusion of all relevant studies fitting our criteria. What are these our criteria? Publication year 2020, 2021. Why? Because it's time for pandemic. Unfortunately, we should to divide our life before pandemic and in time of pandemic and maybe in post-pandemic epoch. Publication source, only PubMed. I was already mentioned that it is reputed scientific database, so we can be sure in verification of the information we read. And of course, open access. So if some journals cover some information and it is paid for information, it's not for all. Only open access, it will be ensured that this will have impact on research society, on civil society sector, etc. And of course, our criteria is mental health issues. Study sample. A total of 163 selected publications were analyzed based on this our criteria. Study method. We used a scoping review research methods to provide an overview of the available research evidence. This method allows us to define particular topics and key concepts in current mental health research. In the review part of this paper, we cited possible related articles. From the relevant literature, we excluded reports of highly specific studies of mental health issues. I mean keywords COVID-19 mental health healthcare, COVID-19 COVID-19 mental health students, COVID-19 mental health children, COVID-19 mental health healthcare workers, COVID-19 and mental health and healthcare workers, etc., etc. So all specific study we don't study, we studies in general. Next part, it is review and discussion. This part contains main our findings, main results. So what these main results are? The analysis of scientific articles on mental health issues published for the period 2020-2021 showed that the subject of the author's research resolves around four phenomena. First phenomenon, the effect of social media on human psyche. Of course, we see a fontaine of information that affected our brain. In this situation, it creates huge challenges for our mental health, and it is continued because we should to continue live in digital world. Second, it is interdependent mental health of individuals, population, and social development. This interdependent because currently all are understanding that without mental health of any population, we can't develop effective and efficient social relations. It's very necessary to see society, it is contains individuals. Individuals, it is her mental health. So mental health of individuals contribute to society, to mental health of common society. Third phenomena is the effect of social restrictions on inter and intra groups relations, especially for women, LGBT communities, children, and other vulnerable categories. The fourth phenomenon is the effect of factors related to COVID-19 pandemic on the human psyche, because COVID-19 has not only direct impact on our physical health, but it has a lot of other economic, political, social impact on our non-direct. Yeah. At the same time, the interest in studying the impact of social media on human mental health is due to observations of a sharp increase in the incidence of depression, suicide among young people during the active spread of social networks and understanding of mental health as associated with the use of information and communication technologies. Furthermore, the COVID-19 pandemic and the restrictions imposed have changed the territorial context of mental health research, real geographical territorials. Instead of the different real geographical and socio-cultural dimensions and territories in which the mental life of the modern individual unfolds in different parts of the current world, the current territory is just a small group. Before it was big group, something like India or Ukraine or Russia or other countries, but now the main territory in which life of individual is conducted is small group. I mean family, friends, and so forth. Despite the processes of segmentation of society, there is a trend of globalization in cyberspace. In this regard, we know that we have some speech that globalization is finished in real life, but in cyberspace is continue, but continue with some modifications. In this regards, along with the term mental health, the authors use the concepts electronic mental health, e-mental health, mobile mental health, tele-mental health, and digital mental health. At the same time, the impact of the pandemic on mental health is being studied by researchers both in a generalized form and in relation to specific social groups and cohorts of the population. Among the factors that have a positive effect on maintaining the mental health of the individual, the researchers identify the organization of social support, a positive style of coping with stress, time for rest, level of education, psychological flexibility of reactions. Despite the large number of articles in which mental health is considered to be dependent on pandemic condition, there have recently been articles justifying the potential economic benefits of investing in mental health policy and programs. In the time when we have meet with economic crisis, we should to ponder and figure out about investing in mental health policy and mental health programs. Okay, and next traditional part is conclusions. Of course, we should not only to fontanize with some words, we should to summarize something. Yeah? Modern scholars have established tendencies to virtualize the mental life of both individuals and social groups as well. The scientific thesaurus introduces such categories as electronic mental health, mobile mental health, telemental health, and digital mental health, etc. Traditional territorial and socio-cultural context are gradually being replaced by virtual space and virtual scanners, on which the mental life of modern humanity unfolds. In this regard, the possibilities, potential risks, and benefits of widespread use of information and communication technologies in the field of mental health care are studied. Next conclusions. The crucial and the clinical and psychophysiological effects of COVID-19 on the mental health of individuals, populations are still, unfortunately, poorly understood. The duration, course, and consequences of the COVID-19 viral disease are still unpredictable, unfortunately, but it is true, it's reality. Many current studies describe and analyze clinical cases and discuss their prospects for developing a new category of diagnosis and treatment of specific mental disorders caused by the COVID-19 pandemic and the restrictions imposed. I have already mentioned about non-direct impact of COVID-19 on the population and of course on the population's individuals' mental health. We have some specific disorders which occurred further to COVID-19 and not only this virus COVID-19 but with social restrictions. Yeah, and next conclusion is emphasis is modern research on individual mental health is based on the idea of the side and long-term effects of the COVID-19 pandemic and suggest that they can be mitigated but adequate and timely intervention. Emphasis is placed on the urgent need for mental health awareness activities and programs. It is noted that psychosocial measures to mitigate the side effects of the pandemic need to be actively implemented, especially in working with the most vulnerable. Emphasis is placed on the need to develop appropriate state and social policies to build a health-responsive economy and health-responsive society at the national and international levels. I would like to again specify that, on my opinion, on my intuition, that health-responsive economy and health-responsive society, it will be the main target for economic growth for any society. Economic, social growth, building of social life, etc. So it's very, very, very potential topics for future development. Thank you for your attention and let's be mentally healthy.
Love this, love this. And it was really, really a lot of information. So I believe we have to go through it a little bit slower. But before we do so, there is a comment here from Kalikuda. So he's asking, does mental health affect or other body parts functioning, such as sexual activities, behavior, and attitudes, and so on?
Yeah, it's a very interesting question. Kindly thanks for this question. It's straight to the point. Yeah, I have already mentioned that unfortunately, effect of mental health virus on mental health are poorly understood, unfortunately, and we only guess. It will have long-term consequences or only short-term consequences on this, of course, it is. And regarding sexual activities, yeah, it's also a very interesting question because in Ukrainian folk, we have some fairy tales regarding two characters. Baba Yaga and Koschei. So this person were punished by gods to live together forever. Yeah. So in this case, it's very interesting. Why? Because if you close your eyes and you understand that he or she is here, you open your eyes and you again, he or she in the same where in the same body. So if you see this only first time, wow, it's cool. You see this next time, wow, it's cool. On the 10th time, again she or he, yeah. So we adopt with her the health. What is the characters of of health cycle. It is habilitation to adopt. Yeah, we can reflect. If we every time, every day, every hours see the same person near ourselves, in this case we adopt this there, and our emotions no so fontanizing, no so bright, yeah, and we adopt with this. Yeah, she is, and it is the roots, it is the reasons of some problem in sexual activities, in sexual life, in sexual behavior, because we know what she will do, we know what he will do, and it isn't something surprise for us. It's not some determinants to make our emotions bright, and we adopt with them, and that's why, or again she, or again this, yeah, it's like a food, yeah. I adore if but if I eat cake for breakfast, for lunch, for dinner today, and tomorrow breakfast, for lunch, for dinner, the day after tomorrow, again the same cake. After the week maximum, again cake. I hate it. I hate it. Yes, that's why. And the same person every day in the lockdown, we are not permitted to go to the to see other person, and we are not able to compare. For example, if I am not able to compare my wife with other person, I can't understand the value of my wife. Yeah. Because we haven't any items to compare.
That's a very good explanation. So it's really hard on us that we are having the person in the same room all the time, and it's not really supporting the interest. It's not really supporting the changing behaviors, the surprises. It's really like you really have them next to you every single day. So good aspects. Thank you very much for the question. And he's coming to another question, and this is something very interesting because it's coming from the audience. I would like to reflect on it without judging the system, without judging anything what is happening in the world. So why are we receiving complaints of adverse mental effects from several people who got vaccinated against COVID-19? Why can the vaccine help them having healthy mental state? So I believe what you need to comment on this is just rather why the vaccine, when you get vaccinated, why it's not changing the mental health, right? Why is it still a problem?
I am not a magician. I am not medical. I am only a specialist in mental health. I am not competent in this chemistry of vaccine. That's why I can't provide you this verified response. On my opinion, vaccination become not only medical, physiological topic, it becomes a political questions. And for example, in my country, we see some increasing number of affected with new diagnosed cases of COVID, but we provided, if you have certificate of vaccination, you are welcome to visit, to live, you are welcome to live without lockdown. If you haven't this certificate, you are not allowed to live free. Yeah, so it is only political questions, not not really physiological, not really medical questions. But at the same time, this political behavior have a lot of reasons. Yeah, I would like to say that we can't to be categorized. So only yes or only no. Each questions have a lot of shadows. Yeah, so the problem of vaccination is like a diamond which have a lot of plant. This place we see this situation, on this place we see other situation. That's why I would like to again clarify, for current situation, the effect of COVID-19 virus on mental and physical health of individuals are poorly understood. We can only guess right now. And vaccination, would it be help? Not it would be help. Thank you for
So I think
comments.
it was a great question, and it was a nice thing that you said, and it's really like up on the perspective. So Kalik is asking whether he can ask more questions. You can ask more questions, Kalik. You are welcome to ask. The only thing we ask you, don't touch political, religious, or really medical specific questions, because we're here only about mental health and how this situation is affecting our mental health. So if you have questions around that topic, we are so happy that you're here. We would like to discuss with you. So please feel free to put your comments there. Only the other questions, please avoid. Super. So he got it. Thank you. So just put the questions there, and whenever it's typed, then I will bring it up on the screen. And in the meantime, I will ask a little bit more about mental health issues. So a little bit of what you shared. So we said that it's really important today to focus on not just the mental health issues themselves, but also how the society, how the economy is affected, how the society itself is taking mental health or health itself as an integrated question, and how it becomes a part of everyday life. So let's just talk about this one a little bit.
Yeah, of course, you are completely right. It's very good. Yes, because the definition is contained not only our physiological process, but it contains our social relations, our political life, and even our economic life. I would like to again specify that, on my opinion, health responsive economy and health responsive society are crucial for future development of any society, because firstly, we are framed in our economic activities. We don't know, will restrictions again established or won't? Yeah. If we will deal with health, we anytime we will be relevant. We will be needed. This information, this our activities for health of anybody will be needed for any individuals, and not only for any individuals, but also and for societies. These social restrictions create a lot of aggression in mental health of any individuals. My aggression, my wife aggression, her colleagues, my colleagues aggression. Commonly, we have social aggression. And this social aggression creates huge challenges for political life. For example, we have Carol Izard and his theory of integrated emotions. Emotions of hate, how it is created. Example: if we cuddle some children, he or she will feel, oh, they cuddle me, they love me. Yes, it's very pleasure for me. But we continue to keep cuddle him, her 1 minute. After 1 minute, children will feel why they, oh, it's not cuddle, it's like closing for me what I should to do. And in these restrictions for her activities, these restrictions creates this feeling, emotion of hate in the children. It is regarding emotion for children. And if we project this for our social life, what we will see? If we have some restrictions in our activities, firstly, or we will think, my country, my government ponder about me. One day, second day, third day, after the week, we will feel, wow, we hate this because we are limited in our activities. It is psychophysiological mechanism to create hate in our mind. And if a lot of person have already established this social hate in their mind, of course we will see some social issues. I mean, some strikes, meetings, etc., etc. That's why the main idea of any government is to create, to forward this hate energy for the constructive direction. Yeah, hate should not only distract something, some political government, some social institution, but this hate should create, construct something new. And if the ancient Romanian rules, divide et impere, we should to divide social government should to divide social hate. It's one part, your hate is other part. So and if we divide this aggression, we create new idea, new value for society. This new value will be your own health. Don't think about governmental rules, governmental legislation. Think about your own health. So it is regarding social and political meaning. That's why this health responsive society very have a lot of potentials for future development of society. And people understand we depend on this, on this, on this. So the main value is my health. That's why I should to deal with this. And we can create some enterprises, some economic context for this. I mean, balneological resort, I mean, other activities for health, etc., etc. So new economic growth, on my opinion, will be based on health requests.
I love this. I really love this, that it should be health inclusive. And at the end of the time, I mean, we are here and our time is more precious here, and our health is so important. To spend this time on earth in a good health as long as we can, that's the most important thing, because then we can help others, then we can help ourselves, then we can just develop a nice economy, nice society, and we can continue to follow our dreams, right? Without the health and mental health, there is nothing after that. And I really love the way how you explain about the divide and the rule policy from the Romans, right? Because it's something that is happening today. We need to be aware of it, that is happening today. Sometimes it's not conscious, sometimes it's happening just because there are so many, as you said, so many different angles of this problem, and there's not really like a right or wrong. There is not really any source that can tell you that this is right. There's no crystal ball that is telling you that if you do this, then in the future everything, because everyone is in the gray area. Everything is kind of like an experimental state. So it's all flowy, and no one knows what's happening next. So it's really, really important that listen back to this information, what Viktor was telling us, because it's super important. Be careful about all this, what's happening around, and make sure you are not affecting everyone else around you aggressively, but take back one step, cool down, take a few deep breaths, and then understand why the people is doing what they are doing, and understand that everyone is in a different mental health state. So you need to understand other people a little bit more today. And also, Kalek is saying health is really wealth, like he was saying, that yes, it becomes something that we can focus on in the future and becomes part of entrepreneurship. It can be a purpose or a social cause. And Kaliko also having another question: why some women and men react adversely whenever they are advised about something? On the other hand, the same person receives and replies positively to other people regarding the same advice and suggestions. So it's about negative and positive response, and it's also about a little bit about gender differences. So let me just unmute you so that you can answer.
Yeah. Uh, Unfortunately, this question is very generalized, and it's not possible to provide you with verified response because all depends on individual context. Uh, what I mean, for example, I know one family and two children in this family, and both of them do something not good, and father come and see uh, for one girl, why you are doing this, and punished her with this gesture. Yeah, and the reaction of the girl, oh father, I love you, I want to do this next time, okay. And the father came to second girl, why you do this, he only said this. Reaction of the second girl, oh, she hidden under the chair, she don't speak with all evening, she doesn't speak, she didn't speak with family. So all depends on individual's reaction. All depends on individual experience context in that situation. Generally, I can say only this reaction depends on level of trust. If you completely trust to one person, you will positively to his advices, to his her advices. So level of your trustness, it will be a level of positive for your reactions. Shortly, this.
Beautiful answer, beautiful answer. I really loved it that you are trying to explain it from the whole perspective, and you are bringing it down there about humans and about personalities, and that everyone has a different environment, a different conditioning, and there is also a lot of things going around, so we never know what will cause what. But yeah, you amazing answers. So I'm just checking on Kalika what is he writing. So Viktor, sir, I deduce that it's personal choice, not really complete matter of mental state. So that's what you are trying to explain, right? So he's asking whether it's personal choice rather than mental state.
Okay. We have some Latin phrases, ex nihilo nihil. Yeah. So all your reactions, all your behavioral reaction, they are constructed from your previous experience. So, in other words, what you have in your mind will be presented in different forms in your verbal reactions, in your physical reactions. Yeah, so that's why a personal choice not really complete mental health. It's complete from your mental experience, not from your current mental health, but from your previous mental experience, from your previous experience, from your physical state in the current moment. For example, if you feel pain in the currently, and this pain is very, very difficult, very problematic for you, you aren't be kind for other person. You can, but you at the same time you can't, because this pain received great deal of your mental attention in this time, and you can't be fully with your reaction for other people, for their situation. That's why all depends not only from mental state, but from social, cultural state, your experience, etc., etc. But at the same time, I would like to say, what does it mean, mental state? According to the World Health Organization, mental health, it is feeling of physical, emotional, and social well-being. In this case, mental health includes all experience, social, cultural characteristics, all. That's why we can say that in this case, in this vision, so your personal choice really depends on your mental state. If we understand, if we define, if we consider mental state as a site-wide definition. So
Love it, love it, love it, love it. Sorry, I had to cut you because I couldn't put it on time. So let's just finish the sentence. I will put you back.
yeah, okay. So all depends from your understanding of this mental health, mental state. So personal choice completely depends of your mental state, of your experience, etc., etc. That's it.
So perfect. So it's actually similar to the saying hurt people, right? So when you are hurt, when you are in pain, most of the time you cannot have the patience. You are a little bit more reactive, you are more aggressive because you have all this pain with you. So it's really hard to calm yourself down and be patient and be nice to someone else. So that's why everyone is reacting totally differently. And then comes other things that Viktor was mentioning, like the conditioning, the environment, the society, the culture, your physical health, your spiritual state, your mental state, and everything else. So you need to see these things in a complex way and see the big picture, and then you will understand it a little bit better where it is coming from. So I believe we really had a beautiful conversation, Viktor. Again, I'm really looking forward to our other conversation, which will happen on the 21st of October with the whole afternoon until the evening here in Malaysia. We will be with you and with other experts that you are bringing on board for the 5th International Mental Health Conference. And I'm so happy to collaborate with you. I know that you were tired, so tell us a little bit, how will you treat your mental health after this call? Because I know that you just finished another conference.
Yeah, it's very good question. Yeah, how I will treat my mental health after all events in September, October, and this month, and this 5th international conference of 21-23 of October. It's not finished because I have else conference 27 of October, but as speaker, not as organizer, and again meeting on 6th of November. So I hope that I will be able to treat with my mental health only in the end of December. I also would like to visit a place between sun and sea.
That will be nice. So we will disappear like the all the audience that was watching for us for 6 weeks here at the Global Empowerment Summit. You will be sure that you will not see me at least for a week. Because I will be also switching off all the buttons and all the electronic gadgets, and maybe I go to the jungle and I will be just without it for at least a few days, because it's really good to reflect on everything what is happening around us. So if you listen to us, please make sure that you are taking some breaks. I know we are bringing you a lot of value here. There are a lot of speakers. We have 70 plus workshops and more than 300 sessions coming up. But make sure that you also have some rest. We have lunchtime. You are treating your family well. You are having your run and you are doing your exercises, because it's really important for us that we are not overwhelming you, but we are just giving you some insights. We are giving you a bigger picture. We are giving you awareness about many things going around today. So thank you very much, Viktor. As a last call or last message, what would you say to the audience? Where can they figure out more about your conference? And how can they just follow you?
Yeah, okay, thank you. I would like to say briefly for our audience, you are welcome to visit, to virtually attend this my conference, and not only in temporal event, I mean 21, 23 of October, but we will share all this information in order to establish continue long-term effect. And you are welcome to choose most appropriate topics for you, and to see these topics in video record. And let's be mentally.
And he said, "Let's be mentally healthy." So that was what he couldn't say. So that was his message. And I'm also having colleague here. I have joined the hub today. Hope to have a lovely time with you all. Of course, you will. And we are planning a long-term collaboration with Viktor. So you will see him for sure on the hub as the mental health specialist, and also other people who are there. And we can support you. Don't forget, we are there for you. Thank you very much. And Viktor, have a nice, amazing day, and have a
Yeah, kindly thanks, and thank you for you. Okay.
Thank you, guys, and have a beautiful afternoon. We are going now further with our program, and we will have an interview with Christina Dimitriades from Cyprus, and he will talk about self-love and self-appreciation. So please watch that too. And later on in the afternoon or the evening here in Malaysia, we will go further, and we will also talk a little bit more about different things, more about leadership as a coaching. I mean, coaching and leadership, and the leader as a coach with Jeff Chia. It will be a workshop from 8 p.m. Today in Malaysia, which is like early morning in California. And you can also watch it from New York, from Canada, from UK, from Nigeria, South Africa, and also from India. So that's kind of like the time when everyone can join in. Make sure you check the emails that I sent to you. You have the Zoom workshop links already in your email address from info@changeyourlifesocialize, and that's how you can join live the workshop rooms. Otherwise, all interviews are streamed to YouTube. So the only thing that you have to do is just set reminders for the sessions that you are interested in. And also, if you want to replay or check back other things, then you can just go to the Replay Global Empowerment Hub, and you can find all the previous live interviews. We will continue the work. Tonight, we will have a beautiful, big surprise announcement. I hope you will like it. We are coming up with money from Soulworks around 9:30, and we will introduce something that we were working on in the background, so that you can get a little bit better summit experience, and you can also have some fun. And tonight we are also on the Clubhouse Global Empowerment Hub club, and we have a room open from 10:45 our time in Malaysia, which is morning time in the US, and late afternoon in the Europe and South Africa. So thank you very much, colleague. Thank you, Marisa, and thank you for everyone who was watching. The questions were beautiful. Thank you, Ria. Thank you, Sharm. Hope you enjoyed. And now I'm switching to the other interview. You will see an interview that I made with Christina, and you will enjoy it because she's a lovely person and she has a lot of wisdom to share with you. So thank you very much. Enjoy the afternoon and see you later tonight with Jeff Chair at the Leader as a Coach workshop.